Hello and welcome to week 3 of NUR 1000. The first thing we're going to do is take a quick peek back to look at the week 2 assignments that you completed. Okay, so you had some recordings about organization, note-taking, and study skills, and then you had some external recordings as well about study skills and note-taking. Hopefully you found something there that you liked and maybe you're going to try out in class. Your discussion board was peaks and valleys, best thing and worst thing about your first week in nursing school. A lot of good information coming back, enjoying your clinical instructors, getting excited to finally be hands-on. Worst case type stuff was mostly related to sort of the unknown of it all, being nervous, not sure if you're studying right, how can I improve my note-taking, those types of questions. So I've provided feedback on your discussion board posts, and just know that it's normal to be nervous and overwhelmed during your first week of nursing school. And as you get a couple weeks under your belt, you'll start to feel more comfortable because you know what to expect from your instructors, from classroom, lab, and clinical. You sort of understand it better. And as long as you're staying organized and on top of your content that you need to be studying, you're on the right path for success. Don't forget, you can always sign up for tutoring with Sister Pat. That's something where you might say, I've never used a tutor before, but it's nice to start off on the right foot. So if you're feeling overwhelmed or unsure what to study, she's your ticket to success. So you could reach out, sign up with her, and you get an exam or two under your belt and decide you don't want to continue tutoring. That's fine. You're allowed to do that. But it might be something that you want to explore. Let's see. Week 1, you had an NCLEX rewording assignment. Let's take a peek at that. All right, for your rewording assignment, let's take a look at these questions. A 52-year-old woman's admitted with pneumonia, difficulty breathing, discomfort in the left chest when taking deep breaths. She smoked, recently lost some weight. She's on IV antibiotics, high protein shakes, oxygen, got her most recent vitals listed there. And at this point, you're probably able to recognize whether vitals are normal or abnormal, so that's good. Which vital signs reflect a positive outcome of treatment intervention? Select all that apply. So this activity was just to take this big question, all the information that's in here, and simplify it for yourself. That's sort of step 1 of taking these NCLEX style questions. Sometimes you might have information in those questions that you don't even need to know at all. Other times they're important, but you can reword it and simplify it and make it easier and help keep yourself focused when you're exploring your answer options. The student put, which of the vital signs show the patient is getting better from treatment? Yeah, I have about the same thing. So what change in vitals indicates improvement? So that's a good one. And if you're not exactly the same, your answer wasn't exactly the same, don't worry. Just as long as you're in the same ballpark and you're understanding what I mean when I say let's reword the question. 2, the LPN provides you with change to shift vital signs for 4 patients. What patient does the nurse need to assess first? She reworded, which of the 4 patients should you see first based on their vitals? I have, who is your priority? The big key thing here is the student kept the word first in her rewording. And my rewording, I changed it to priority. Those are important keywords that'll help clue you into some test-taking strategies you can use that we're going to learn later in the semester. So if you see any words that are like, who are you going to see first, what's most important, what's your priority, those types of things you want to keep in your rewording because those are important keywords that help you know what sort of test-taking strategies we're going to learn that you can use. Question 3, you got a healthy patient. Got his BP at one of the quick machines in the mall, and he was alarmed because it was so high, and he's normally running lower than that. The nurse takes a blood pressure, and it's in line with what he's normally been getting. What would account for a blood pressure that's 152 or 92 or higher than what he normally gets? This student put, what thing might account for a false blood pressure reading? I have, what causes a false elevated blood pressure reading? So we're pretty much on the same track there. Question 4, the nurse is assessing a patient who returned an hour ago from surgery for an abdominal hysterectomy. Which assessment finding would require immediate follow-up? And we got here, the student put, what vital sign or discovery would require immediate action? I have, what are we on here, 4? No, my numbers are off here. Let me look. Hold on 1 minute. I'm lost on my paper. Let me find what I have. I found it. My rewording was very simple. What assessment finding is bad? So I think the students is actually better than mine because she left in this keyword immediate action. So that's letting us know this is some high priority finding that we're going to see. So that was a good rewording by the student. The nurse is observing as a student performs a respiratory assessment on a patient. Which action by the student requires the nurse to intervene? What action would the nurse decide to intervene for patient safety? I have down what is wrong or what action is wrong or incorrect. A question like this where it's saying what of your answer options is wrong or do you need to intervene because they're doing something incorrectly? When you reword it, it's important to flag yourself that you're looking for the wrong answer option or incorrect answer option. Because sometimes what happens with these types of questions is the students start reading their answer options, they forget that they're looking for something wrong. The nurse is going to intervene. And we're doing a respiratory assessment. And, oh yeah, I know I do that with my respiratory assessments. And they pick an incorrect answer because they forget that this question is asking what is wrong. That was it for your practice questions. Hopefully going through and discussing that rewording is helpful for you. And finally, you got a practice assessment quiz for week 2, and that was more for me. We'll do the same quiz later on in the semester, and we'll assess how your score has changed after you've learned the test-taking strategies you're going to learn in this course. Okay, so let's hop over now and see what we're doing in week 3. All right, for week 3, you're going to read chapter 3 of your textbook. You're listening currently to your week 3 greeting, so you're knocking that out. You have 4 additional recordings, so 5 in total for this week. That's more than you normally have, so you're going to get through these recordings. You have your greeting that you're listening to now, your recorded lecture from me about learning preferences, active reading, test anxiety, and self-care. Then you have 3 external recordings. One's about discovering your preferred learning style, what you identify as your preferred learning style. Another one about active reading. And then finally, a video about self-care. Your discussion board this week is going to be about your learning preferences. So that'll relate back to the videos that you're watching there. And then you'll also have an assignment with some practice questions. If you have any questions or problems while navigating through the module, please don't hesitate to reach out. I know for week 2, it didn't publish when it was supposed to, and somebody reached out, so I was able to fix that. Somebody reached out and said, I don't quite understand what this rewording activity is about. How am I supposed to do that? So please don't hesitate to reach out if you ever have any questions about anything with this online course. I know it's hard since we're not meeting in person and we can't talk face to face, but send me an email, schedule an appointment, and we can get everything fixed, everything worked out that you might be having problems with. Okay, so a couple more reminders. So you're entering week 3, sort of settling into a groove. Don't forget when you got your books, your book bundles, some of those books will come with like cardboard inserts for additional online products like your EAQ products, things of that sort. Do not throw those cardboard inserts away. And if you haven't accessed the product and like signed up for it and written down your username and your password and all that, talk to your lecture instructor to see if you can get help doing that or when you're going to do that as a class. Another reminder, under the Start Here module, you have some information about printing. All right, let's see if I can pull it up. So the Start Here module, and it's campus printing for students. And there it is, just a reminder, each term you have $8 worth of printing credits that registered students can use for color, black or white printing. Let's see, it looks like black and white's 5 cents per page. Colored copies are 20 cents per page. And you can add additional funding or additional cash to it. Lets you know how to add that on and how to use it. So if you have any questions about printing on campus, don't hesitate to reach out. One thing that a student pointed out, and I forgot to put it in last week's greeting, was that sometimes students can have problems using Safari as their search engine, whatever they're called. I'm not IT, I don't understand why things are the way they are. But I do know that if a student reaches out and they're saying they can't access the module, they're having problems with the online course, they can't access the EAQ or the VSIM sort of online supplemental products we have, one of the first things I'll ask is, are you in Chrome? For some reason, students have problems if they're in Safari, so just keep that in mind. Hopefully you're using your study calendar and tweaking it to make sure that it works for you. Some big takeaways that I noticed when looking them over is make sure that you're not just having like on Saturday, I'm studying 4 hours for foundations. Because like one big block of studying per week probably isn't going to be as beneficial as it would be if you divvied it up into smaller study sessions throughout the week. I will say too, for those big 3-hour courses, any course really, one of the best times to study is going to be immediately after the class that same day. So you don't want to go to foundations on, when do you go there? On Tuesdays, right? Don't want to go to foundations class on Tuesday and then not look at that content again until Friday. It's important to review the content the same day that you learn it. It helps it stay fresh in your mind. And make sure that you're reviewing it on a regular basis. Remember, 1 credit hour is equivalent to 3 hours of studying outside of class. So for a 3 credit hour class like foundations, that would be, you need to be earmarking at least 9 hours outside of class for that. Don't forget also to schedule some self-care in. I saw a little bit of that, but you want to make it something that's intentional, or else that'll be the thing when you're feeling busy and overwhelmed that you don't do. So make sure that you are earmarking time for whatever type of self-care activities you like. I encourage you to be as specific as you can when detailing what you're going to be studying in each of your study sessions. So not just foundations, but what exactly is the content you're going to be looking at. That'll help you as the exams are coming up sort of identify content either that you didn't spend enough time on. Maybe you can identify topics that you need to really spend more time on when preparing for an exam than the other topics. Lastly, make sure you schedule in some extra just fluff study hours, because life happens, and surely it's probably happened to some of you guys already where you got your schedule planned and then you get sick, a kid gets sick, you get called into work, those types of things that really throw off your schedule. So always have some extra hours earmarked for studying, even if you don't use them, because there will be some time when you are going to have to use them. A couple reminders. So we're going into week 3. You sort of get in the groove of this class and understanding what's expected. I wanted to remind you about the word count requirements for the discussion board. Initial posts are required to be 150 words, peer responses 75 words. So going forward, if you're not meeting those word requirements, you're not going to get points for the activity. Also be mindful of when things are due. Make sure you're doing the complete assignment. Sometimes students do forget to go back and do those peer responses. So make sure you're keeping up on that, because I think your reminders only list the initial due date. So the peer response is something you're going to have to keep track of. But make sure you're keeping up on it. Last semester I got into a little trouble by not requiring students to keep up on their missing assignments when they were happening. So at the end of the semester, I was sending out mass emails and blocking modules and trying to get everybody caught up. This semester, I'm going to do it a little bit differently. So you might not be able to progress to a module because you have something missing. I always note it, either note it sort of as a, where I have the grades make a note, or send you an email saying, hey, this is missing and you're not going to be able to progress until that assignment's completed. If that happens for you and you don't try to progress until Wednesday and then you realize it and you make up your missed assignment, but your other assignments end up being late, that type of thing, those assignments would be late, so you'd lose credit for it. So due dates are going to remain the same whether you have access to the module or not. You want to make sure that you stay on top of your assignments. I think that's it. The last thing I just want to say is don't hesitate to schedule an appointment if you're on campus and you want to stop in and say hi. If you have any questions about this course or the program in general, I would love to see any and all of you. And my door is open, and if it's closed, knock and we'll get you in and answer any questions you might have, or just talk about your accomplishments. So that's it for today. You guys have an excellent week 3. See you for week 4.